Okay, everybody. So my name is Melissa Street, and I'm one of your hosts for this Impact Health Share webinar that we host every Tuesday at 12 o'clock Eastern Time here on Zoom. And normally we share a lot of great details about Impact down to the very first beginning of how it all started to answering questions and answers at the very end. But we do have a special guest here today, and we want to give him as much of the Zoom floor as possible. But I want to kind of share some logistics first. Number one, I am going to post the link to Impact Health Share's guidelines. It is a fantastic tool that I personally still use today myself. I recommend you guys to save that somewhere in your notes or in your phone, somewhere that's easily accessible, just because it's very transparent. It's very straightforward, all about ethics and honesty. And it's not a bunch of gibberish that you have to read through. It's very straightforward. Also, we do have a Facebook group. I will post a link for you to join if you have Facebook. It's not an Impact corporate organization Facebook group. It was something that a handful of us came together to form just as another resource, as another tool where people are sharing their testimonials, people are getting their questions answered in there. It's another way of forming a community within the Impact family. And so on Facebook, you can search Health Share Crusade Community. If you just search Health Share Crusade Community, you'll be able to find our Facebook group. But let's rewind the clock a little bit to a few years ago, how my husband and I came about Impact. Number one, we are self-employed 1099 contractors. Do we have any business owners or self-employed contractors on here? Lots of hands. Okay, so you know the pain when it comes to healthcare. When it comes to healthcare, when you're self-employed, you're the one paying for your own, fully paying for your own healthcare costs. And so for my husband and I, we used to have a company. I don't want to disclose their name, but their logo had a blue cross and a blue shield. And we were paying almost $1,000 a month just for the two of us. And praise God, we're healthy people. And so we were just kind of having health insurance for just in case. Anybody on a similar boat? You had it for just in case, and something in case of something bad happens or something big happens. And so we were paying $1,000 a month in premium for the two of us. Our family deductible was $15,000. We thought it was $7,500, but when we really looked at our papers, when we were comparing it with Impact, it turns out it was a $15,000 family deductible. And we thought that was the norm. We thought that was okay to pay $12,000 a year in premium. And then 3 or 4 years ago now, somebody introduced us to Impact. And when they quoted us, they dropped our deductible into half from $15,000 to $7,500 as a family. And our cost went from $1,000 a month in premium to $364. So that's almost $8,000 a year in saving for the two of us. Now, I don't know about you, but $8,000 is a lot of money. In American household today, that's a lot of money. I'm sure you'd rather spend that money on other things than paying for a health insurance premium, right? And so then we got cautiously optimistic. Our questions were, well, what's wrong with it? Why is it so cheap? Is it one of those things that if you pay less, you get worse? And we were just really hungry for information of how does this work? How is it possible? And then when we really understood the value of Impact, when we really understood really how it works, that's when my husband and I, alongside several leaders, came together and said, this is information that needs to go to the masses. We can really help our community, our friends, our family members find affordable healthcare and for the better. And so for me, it was really hard to grasp the idea of healthcare in a community standard. Like, I didn't know what it meant when they said, hey, this is more of a community approach of people showing up for one another and coming together to pay for medical expenses. I'm like, huh? What does that even mean? And so I'm a visual learner. I don't know about you guys. I'm a visual learner. And so Impact made a short 90-second video to give you a visual understanding of what it means to have community approach in healthcare. And so let me play that video, and then we're going to dive right into our special guest speaker here today. So here we go.
You just saw an example of how health sharing works. Simply, people helping those in need. Here at Impact, we're slightly different as we use a proprietary decentralized technology that allows the transfer of monies through a secure digital payment system. That means all the sharing happens seamlessly from members to the share account of the member in need.
All right. Okay. So I mentioned about our Facebook group. So again, you can just search Health Share Crusade Community or scan this QR code and join us. You do not have to be an Impact member to join the Facebook group. Use it as a resource, use it as another way of meeting our members or getting questions answered. But a couple things is when it comes to healthcare, what we have found and what we've researched is what most people want. Maybe you fall into these categories. What most people want is affordable monthly premiums. How many of you fall into that category? You want to be able to afford your healthcare, right? Affordable copays and affordable deductibles, your out of pocket expenses when you do go visit your providers. Most people want the freedom to choose the doctor and facilities that they want to go to. So no network restrictions. Maybe you're, told the best doctor for your child's sickness is at that hospital, but guess what? They're out of network, right? Most people want to be able to provide the care that their family deserves. And then employers. I know we have a lot of business owners on here, small business owners. You want to be able to offer healthcare, but when you look at the price tag, sometimes it's just so unaffordable, which breaks your heart, right? And so this is what most people want. And now I want to introduce our guest speaker here today, the mastermind behind creating Impact Health. He is an absolute hero in my world. I love that he takes the time to be here on this Zoom call with us because he was so excited when we call him, would you please do it? And he was like, absolutely, when and where. He's just that type of guy. And, whenever we hear from him, there's so many golden nuggets that we learn. And he's going to share some new exciting announcements about Impact. So you guys get ready, listen, pay attention, pull over if you're driving. We don't want you to get distracted, but please help me welcome CEO of Impact Healthcare, Mr. Phil Chrysler.
Oh, wow. Very nice, Melissa. I so appreciate you and appreciate your husband, Jeff. You guys have been terrific partners as we've, come together and said, hey, America, there is a better way to reserve and pay for your healthcare expenses in a more meaningful way, right? And so I just so honored to, take some time with you and your growing community. Wow, you got a lot of people on this Zoom, getting close to 400. That's fantastic. Congratulations. And it's an honor, really is an honor anytime I get a chance to talk to folks. Because, your story is what drives our purpose, right? Where you get to save that money that you were spending and you get to repurpose it, right? You get to repurpose and do other things with that money you get to save in a more meaningful way. And so that's really what we're all about. I want to take everyone kind of to talk a little bit about the past of healthcare sharing. If you're not familiar with it, how we got here. I want to talk about the present, where Impact sits today. And then, as Melissa alluded to, we're going to talk about some really exciting things that are just right around the corner with Impact launching. One of them as early as this Friday. So we're going to talk about the past, the present, and the future. So here we go. I'll be as quick as I can. So, since the dawn of time, right? People have led, have wanted to, have felt the desire to help other people, right? And so that I hope is always going to be an important fabric of America and beyond, right? Certainly it is in the impact community where we're always going to want to lend a hand to someone in need, and having those principles, those guiding principles is really what powers impact health sharing and healthcare sharing in general. You remember the days or heard about the days where in church people passed the hat because somebody in the congregation needed assistance, whatever that financial assistance was. And if you could afford to, you put some money in that hat and they passed it up and down the pews, and then the preacher took it and gave it to the family in need, right? And that's what community is all about, being there for one another in your hour of need. And that's really what Impact's all about. Healthcare sharing got started in a very similar way. Unfortunately, a pastor and his family were actually involved in a car accident. They didn't have health insurance. This was in the early 70s. And so what happened is that church, that congregation raised money to pay for the medical bills for that pastor and their family. And so he said, wait a minute, if this can work for me in a very meaningful way, then it can work for millions of others in the United States and beyond. And so that was really what propelled healthcare sharing to begin in the early 70s. Just one or two organizations, others came and formed, and then the turning point really for healthcare sharing was the Affordable Care Act. If you remember, that got passed in 2010, right? The Affordable Care Act was passed, and at the time, a lot of promises made about what was going to happen and not going to happen, keeping doctors and all of that. One of the things that did occur, though, is that if you didn't have health insurance, your family had to pay a penalty, what was called the individual mandate penalty at that time in 2010. And that was with the launch of the Affordable Care Act. The only exception to not paying that penalty was if you were a member of an existing healthcare sharing organization that was in formation at that time. And so you just had a small handful of national Christian based organizations, and then a bunch of different small Mennonite organizations scattered here and there throughout the land. So there was really no sophistication. There was no processes or anything like that. It was very manual and it was very word of mouth. And but what happened is millions of people said, I don't want to pay that individual mandate penalty. I don't want the government telling me who I can go see, who I can't see. And they just didn't want government involved in their health care. And so millions were motivated and learned about an alternative called healthcare sharing. And that's what drove the real strong growth for, gosh, over a decade and still today, right? As more and more people learn about it. This is, I would argue, fairly unknown to the masses. And that's why it's so important and such an opportunity that Jeff and Melissa have and others that are on this call to champion this growing alternative to the high cost of health insurance in a very not-for-profit, faith-based, community-driven way. And so excited and thankful for the Affordable Care Act because it positioned healthcare sharing to be nationally known and be aware, and then it motivated people like myself and my wife who co-founded Impact Health Sharing to usher in this alternative and do the best we can to make this well known that no, you can spend less than traditional insurance, and we're really, we're best served for the fairly healthy to healthy. And you got to remember, 5% of the population drives about 50% of the medical spend. So what's happening in this country is a lot of healthy people like Melissa, like Jeff, are overspending on health insurance for something that they rarely use or need. And so once they understand the concept and get educated and see the pricing and understand the transparency and community-based approach we have, you get really excited about ushering in, because this is such a large expense for families, right? Right next to your mortgage, it's typically healthcare, car payments are right there, number two and three. And so when you can introduce them to an idea and a track record of a community-based, not-for-profit healthcare approach, they're open to it. And I can tell you, with where we sit today as a country and what's going on with certain legislation that has passed, and I'm going to get it to that in a few minutes, the opportunity is even far greater than it's ever been. You're going to see more and more people. You're going to see more and more families, more and more individuals, more and more small businesses be wide open to alternative ways to bring down their healthcare costs. And so, my wife and I back in we found out about healthcare sharing in 2018, and then decided in 2019 to form our own organization. We did it though with a group of people that had 100 combined years of scaling one of the more popular and well-known healthcare sharing organizations that are in today. Two of those people are former back-to-back president and CEOs. But when you take those two and their team, it's 100 combined years they have in healthcare sharing. And when they joined that organization, it had about, just a few thousand households less than what we do right now. We have, over 18, almost 19,000 members today that represent nearly 10,000 households. Well, when they joined the previous organization, that had about 8,000 households. When they left that organization, it had 145,000 households that was serving 400 to 500,000 members. So significant growth that occurred in a very manual process, right? Because they didn't have technology like we do today. That was one of the exciting things, and one of the key reasons we formed Impact is at the time when we were talking to them about their previous experiences, and the conversations that they had had with their members, the conversations that they had with their providers, with government regulators, with all these different dependents, right? People that were depending on what they did. They said there's a better way to practice and leverage technology to implement healthcare sharing. You see some good organizations today that serve their members terrifically and honorably, but they do it in a very manual process. It's not unusual if you have a medical expense with some to get 60, 80 checks in the mail, and then you have to reconcile all that. That's done today, friends, in healthcare sharing. Not so with Impact Health Sharing. We were the very first healthcare sharing entity that launched in 2020 that ushered in this never before technology platform that gave potential members, 24/7 near real-time access to see how much money was in our distributed reserves. So you had a sense of how financially strong or not we were, how quickly we were paying how quickly the community was paying its provider. So that told a story. So just by clicking that community dashboard that you see, you have a sense of how we're performing financially, and that would give comfort to members and potential members. And we were the very first organization to introduce transparency and real-time data in that, and unfortunately, still today, one of the only ones that publish that. But we're proud of doing that. We're proud as one of the younger healthcare sharing entities around to lead the industry in transparency and lead the industry in how quickly Impact is paying bills today. Since inception, we've processed, gosh, we have to be very close, right around 150,000 medical bills the community we process as an organization. And we are sending payment out to our providers in about 10 to 12 business days. Friends, that's not being done by any healthcare entity, whether it's health insurance or whether it's another good healthcare sharing organization. We are just flat out paying providers quickly. And we do that for a number of reasons. One, we want you to be seen as a good paying customer to your provider, to someone that you have that relationship with, right? They want to know how quickly they're going to get paid. And so once we get that bill, we reprice it, and then we send payment out. You meet your responsibility. If you've already met your responsibility, that payment 10 to 12 business days is going there. We have established such a good reputation. We've had large facilities like Tenet Healthcare who traditionally have not accepted any healthcare sharing plans, but says, oh, your impact, okay, we understand, we have a track record there. They have taken us from the West Coast to their facilities all the way to the East Coast because of our track record of paying our bills quickly at fair market value prices. So we continue to build upon that good reputation in our billing team, led by our terrific Dr. Maharaj, who's not only our Vice President of Billing Operations, but also our medical director. Her and her team take tremendous pride in turning those payments around quickly, again, at fair market value prices. You see, providers accept our pricing 98.5% of the time. 98.5% of the time. We only have to argue 1.5% of the time. That's it, about why they want to charge more and we want to pay less. And then guess what happens? We end up somewhere in the middle and paying that bill. Never, and I don't think any other healthcare entity, again, health insurance or healthcare sharing entity, could make this claim. We have never let a member, whether you left membership or not, but if you had that ailment during being during your membership, we've always paid that bill. No one has come in and said, "Oh, I got a summary judgment issued against me for non-payment of a medical bill when I was a member of Impact Health Sharing." Never occurred, never will on my watch as CEO. So another important distinction that not all, I would argue, all healthcare sharing entities, I believe, are good and want to serve their communities terrific, but not all perform well like we do at Impact Health Sharing, or as transparent with our financial data and how we sit financially. And so very, very proud of those those key features. We've done a lot of things in the last 5 years as our membership has grown double digit year over year. Things like we didn't have a annual wellness visit, right? And or a lab credit that wasn't part of the feature and benefit list at the time, because we weren't we're not for profit, so we weren't sure what we could afford. We did projections, right? And fortunately, those projections have been just dynamite. They've been accurate, and I don't credit myself. I credit the team that we partnered with to help form and architect Impact to be a leading healthcare sharing entity in that way. So just excited, about that. So we continue to add features like that. Melissa will know that when she joined, we didn't have a vision dental discount plan. And guess what? We do now. And we did not raise the price to pay for it. We just made it part of the features and benefits. And we have this track record of, recently we changed our pregnancy guidelines from 12 months to 10. So, when a member joins, they can not worry about, pregnancy wait times, things like that. So that's the power when you have a community-minded, servant-minded, I would argue, mindset, and you're not for profit, right? So I have no capitalistic tugs of shareholders saying, I demand you maximize shareholder value and at all costs. And we have none of that going on here, right? We serve our members, and we're designed to serve our members in their hour of need. And so that's why we can take vision and dental discounts and add it as another perk, right, at no additional cost. And so that's why we continue to relax guidelines and look for ways to serve more. And as we continue to build on our very, very strong distributed reserves, which is, well over 10 months right now, and which is terrific. That means that if 100% of our membership quit today, 100% quit, and we still had the same exact amount of bills still coming in, we would have 10 months to pay all those bills. Neither scenario is likely, right? But that just tells you financially how we sit. So we're able to be member centric. It's not a slogan for us. It's something that we can point to and say, oh yeah, hey, what will serve and add the community in a more meaningful way? Well, how can we do that? We continue to do that. I've tasked our medical director recently to look at ways how through programs we might be able to allow in people that have diabetes, things like that, right? So we can serve them in a more meaningful way without, sacrificing the financial integrity of the organization, right? We still need to pay bills quickly. We want that narrative that builds provider acceptance, that builds member confidence, right? And there's and it lifts up the brand of impact, and I hope in general lifts up the brand of healthcare sharing as well. That it, when done right, it can be a credible, meaningful alternative, an effective alternative for its members. And so presently we're in we're in just such a terrific position. I want Melissa to bring up the slide number one that will talk about the recent legislation with the big beautiful bill, I think as it's called. So presently, this obviously is legislation. This is law now, but here's the effects. Of course, going into this, we already had premium increases year over year over year that were significant by health insurers, right? What happens is you have to apply for and on the ACA, tell the government what you're going to be doing for the following year's plan. And so we know last year for this year, I think on average it was 7, 8%. Some have seen a lot more significant. And so we knew going in prior to this legislation already, the majority of consumers were going to be faced with increased costs on their health insurance bills, right? So now here's what's going on as we sit today, and there's more to learn. And this is just a couple talking points for me to point out about the federal tax and spending bill, what's known as the big beautiful bill. And we'll create something. We have some more articles to read, some more intel from our Washington lobbyists to obtain, and some more data to get through. But we'll create something. Here's the opportunity that is only going to further motivate individuals, families, small businesses to be more open than they've ever been about alternative ways to take care of their healthcare needs and costs. And so so small group health insurance, there's premium increases. What happened was, if you remember, with the ACA, you had subsidies that was around 200% of the poverty level. COVID hit, they expanded those subsidies to over 400%. So that meant people that were in the middle income and higher income bracket were eligible for some subsidies. Those were COVID era driven, and they were set to expire anyway the end of this fiscal year. Well, now it's just more clear and obvious that they are expiring. So you're going to see the middle to upper income people that had those subsidies go away. And small businesses are going to have stricter eligibility requirements because during the COVID era, those subsidies were automatically renewed. They weren't checked. Now there's income verification. So if you make more than $1 than what you previously did, those subsidies are going to be clawed back, and how that's going to happen, that means a clawback from your insurance premium and any medical bills. So it's going to be a potentially problematic for millions and millions of individuals that were used to those subsidies. They're gone the end of this year, and the automatic renewal to prove those is no longer in place. It's more of a manual verify process now. So which is going to be burdensome, and then but also is going to expose some people that are going to be needing ways to find reduce healthcare costs. So you have that. Obviously, the administrative burden to prove that process. You got changes coming to Medicaid, but then on the individual side, right, on the ACA insurance market, you have another reduction in subsidies I had talked about. Certainly, Premiums are going up. I saw what was it? Kaiser Family Foundation recently reported insurers in the ACA marketplace are requesting their steepest rate hikes in the last 5 years, on average of 15%. On average of 15%, what's coming. And so I've seen requests from well-known insurance companies in the state of Illinois on some of their plans as high as 27%. I saw a recent request from a well-known, Melissa may have referred to that entity earlier, and some of their plans in Texas at a 21% increase. So cost increases are coming. They're going to be here to stay for a while, and so the individual market through the ACA and then certainly through the small group health insurance market again are going to be force for ways to look for alternative ways to reduce their healthcare costs, but yet still have a comprehensive program in place, right? And that's the beauty of the impact. All we've done is add to our comprehensive program. We haven't taken away in our last 5 years, and there's no financial reason for us not to continue with that philosophy. So we sit presently in just such a terrific spot. I know, for those that not only want to be a member, there's also referral opportunities that Melissa and Jeff can talk about if interested, where you can help spread this news to be a hero, right? To be a hero to that family, to be a hero to that small business, to that individual, and in their hour of need, serve them in a more meaningful, cost-effective, transparent, not-for-profit way, right? And so I couldn't be more excited, couldn't be more bullish about how we sit today and how we collectively, as a group of influencers, will be able to champion and serve people in a very, very meaningful way. So, again, lots of changes coming. Increases are already here, and more are already coming. So that's presently what's going on. We've talked about the past, how healthcare sharing got started, the good companies that serve their communities in a meaningful way, more manually processed, more of a strict religious process. Some of them say, you need to have your pastor sign an affidavit before we let you into membership. And so, even though we're a faith-based healthcare sharing community, we're Christian. We practice the love thy neighbor approach, right? And what does thy neighbor look like? They look different. They look different, right? And so we welcome all races, religions, colors, creeds, because that's what was commanded to us to welcome into the community and to love thy neighbor as thyself. And so that's the difference with Impact. There's none of those silly, affidavit requirements or anything like that before we allow people into membership. And then presently, we're performing really well. You have access to a member center where you can see for your own self. You can encourage other people to pray for each other. We don't tell you what your ailments are in the member center, but and if you wanted to remain anonymous and you didn't want your last name, you're able to do that as well. But we wanted to create this community inside a community because praying for each other, encouraging each other is what some of the best aspects of the American people, and I love that, and we try to capture that in our member center, and it also gives you again financial data that'll tell you how we're performing. So if you have questions, comments, concerns, you can call us out right then and there, and that's the ultimate proof of being transparent. It's one thing to say it; it's another thing to actually point and say, here's all of our financials. You see what's going towards admin, program fees, what's staying in your member-owned accounts. And so I love that we're one of the only ones that do that, and we were the first to do it in healthcare sharing. So we sit today really, really strong. Let's talk about the future. So a couple things coming up. I talked about our wellness visit, right? That was new a couple years ago, and our wellness with the blood credit. Now we have a concierge program rolling out on August 1st, which is Friday. So if, it's you basically tell us your provider that you're going to see, and we are involved in that payment process to be a partner in that. It's not an emergent situation, right? So you got we'd like about 5 days to work with them, but if they won't bill us, right, then we'll prepay. I don't know of any other healthcare entity in the United States, health insurance or healthcare sharing, that's actually prepaying for a wellness visit, right? If needed. But if a provider won't, if they don't want to learn about us or whatever, fine. We have this concierge team that is just a phase one of some exciting concierge add-ons that will be rolling out in the coming months and years. So this is just phase one of that. That again is launching on Friday. Another way to partner with you and be member centric. And then two, just a couple months away, we have a new prescription program that's coming out. Excited about our basically our wholesale pass-through prescription drug program. We for years could never find another entity that could beat our prescription prices. Well, we found an entity that did that 9 out of 10 times, and so we're very, very excited to introduce this enhanced prescription drug program. It's going to lever coupons when applicable on the specialty and brand drugs. So again, delivering savings to our members. But here's the coolest part. Right now, 65% of our prescription fills are $10 and under. Those are now going to be free. So at no additional, so if you have a prescription, that you're getting and it's $10 or under with our new program, there will be, you'll pay nothing for that. And guess what we're doing? We're not adding any cost to your monthly share amount to pay for it. So again, why we're not for profit when we can do things like that when we're financially able to. So that's coming in the next couple months. The team is just working real hard on updating the member ID cards that you get as part of your membership and things like that. So exciting enhancement on the prescription drug side. Other entities talk about it. Politicians talk about reducing the cost. Well, we're actually doing it here in about 2 months. So again, with the new program, if it's $10 and under, it's free for you. So excited about that. And then really excited about this community impact initiative. If Melissa will bring up the slides, here's the thinking behind this. We said, how can we partner with our advocates, our influencers in their community, going to see their providers, telling them the great results and what they can expect by billing impact health sharing. You can expect that pricing that accepted 98.5% of the time. You can expect payment at within 10, 12 business days at fair market value prices, right? Those are great stories to tell. And that we have a growing group of members that are looking for provider friendly places to go. And so, but we said, you know what? Sometimes because of our good incumbent healthcare sharing organizations are processed in a very manual way, we wanted to, there's a little bit of a horse and buggy imagery associated with healthcare sharing. And so, what could we do to just flip that impression, to change that narrative, to make a terrific, first impression when we went to solve them, right? We have a tech-centered platform that really powers impact health sharing community. Well, what if we show up and provide a very cool, immersive experience telling them the impact health sharing story? So what's happening is we partnered with a leading entity, and you're going to see at the end of this slide, not yet, but at the end, you're going to see their list of customers that they've done. We're actually creating videos specific for this initiative that is going to tell the impact story in a very meaningful way. We're going to tell it to consumers. We're going to tell it to providers. We're going to tell it to advocates that want to, influencers that want to go out there and partner with us to advance this terrific, great cause of not-for-profit, lower cost, affordable healthcare, backed by a community. And so but we're going to do it in a fun, cool, never been done way, right? Because that's how we roll. This actually, so yeah, so here's the vehicle. This is not the official wrap of it, but that is the official vehicle. You can see in the back, you'll have steps that you go in. There'll be a greeting room, a coffee bar area, iPads to enter your information so we can capture it for you and for our referral partners. And then you're going to go into this immersive experience. We're going to entertain you, right? We're going to entertain you about what we're doing differently. And so you'll see a little bit about the beginning room there, and then through you'll go to the open area, and we're going to be able to sit about four people at a time and take them through a minute and a half, 2 minute presentation, and why tens of thousands are considering and have joined impact, and why more and more will be open to the opportunity. But we're going to do it in a very entertaining, immersive kind of way, and we're going to take this to city by city. We're going to take it to events where our influence and partners are, so they can bring their customers or guests out to see it. We're going to then go to their providers the next day in that community and get them information on impact and who we are and why they should bill us. And we're going to entertain them a little bit, give them a little giveaway, and then we're going to, vehicles like this can go to think of, tailgating games, right? Football games, right? Or healthcare events, or all kinds of different opportunities that to help advance the narrative and the impression and the cause of how helpful impact can be to millions and millions of growing Americans that are going to look. This is what the vehicle looks like. Again, we haven't figured out the wrap yet, but that's next on the list. It's actually being built right now. Content is being shot in Vancouver, Canada next month. And then we're going to roll this out. We hope to launch it in the great state of Texas in the 1st of November. And so we'll be working with Jeff and Melissa and their extended team on how we can, tell this story over and over again, and go make a community impact in a more meaningful way. So that's, the past, the present. Here's the brands that have partnered with this company that we've partnered with that are helping us tell the impact story, and they're in love with what we do. And so I'm just excited about what the vehicle's going to look like, the video, and the whole immersive experience, and what the impression that's going to get. You can clearly see they have some big brands that they partnered with. We're excited, come November to have our brand added to that growing list of brands, and it's going to be a fun way and a new way to really tell, in a different, meaningful way, entertaining way, to tell the impact story and the great news that's what's going on with our vibrant, growing community. So, Melissa, I'm just so thankful for this opportunity, for you and Jeff, and for the great work that you do to help advance our cause, and for the time today that you've given me to talk again about the past, the present, and then a little bit about the future.
Well, I'm grateful that you've opened up the past, just to really have us all have an understanding of where impact came from, the root of that. And then I'm excited for the future. I am so excited. I love that you let us in on what you guys are working on behind the scenes and get a chance to experience a little teaser of it. And, as Phil mentioned earlier, this is information that needs to go to the masses. And there is a referral partner opportunity. So, whoever invited you on here, if you have an interest in being a part of the crusade of sharing this information with the community, get back to whoever invited you on here, because for one, the harvest is plenty, but workers are few. And with what Phil just mentioned of what's about to approach in these next coming months with healthcare and the amount of people that are going to be heavily affected, they need to know that impact exists, and they can't know impact exists without us telling them the good news of impact. So let us know if you're interested in the referral partner piece of it. But, I appreciate Phil just sharing really the depths of who Impact is and where we're going. And as I mentioned earlier, we normally, on this Zoom call, we normally go into the logistics, a lot of details. We show the back office, the portal, we give live quotes, we do live Q&A sessions, but I wanted to give Phil as much of the floor as possible. And so if you would like to join us next Tuesday for our normal Impact call, please come back on, same time, same link, same Zoom call here. We would love to have you. But before we wrap up, Phil, thank you again. Any other last notes you would like to share with our growing audience here before we wrap up?
Yeah, just how big the opportunity is, right? I mean, the Affordable Care Act certainly propelled healthcare sharing, right, to its day of having millions of members, right, throughout the U.S. And then you have, legislation, law now like this that is going to have a impact, pun intended, right, on millions and millions more of small businesses and families and individuals. And let's not forget the growing 1099 crowd, Melissa, that you're all about, right? And so you take all of that, coming together, right, and then you couple it with an affordable option that's built on transparency, that's built on servanthood, right? That's member based. And I think you got a powerful, powerful future in the coming years ahead of us. So thank you again for the opportunity.
Thank you, thank you, thank you. All right, so just some quick last notes I want to share because Phil mentioned it earlier is who's impact for. I think we can all come up with a list of people that fall into these categories. So just as a last note, who's impact for? Healthcare sharing may not be for everybody, but for many, many, many individuals, millions, especially those that are generally healthy, impact offers an incredible affordable solution like no other. And so think about people that pay for some, if not all, of their own healthcare costs. So people like families, individuals, entrepreneurs, self-employed, freelancers, gig, part-time workers. So think of like Uber drivers, content creators, micro influencers, independent direct selling distributors. Think about service industry workers, so hairstylists, massage therapists, waiters. Typically, where they work, maybe they rent a station, they rent a piece of a salon, and they're not provided healthcare because ultimately they're also 1099 contractors. Senior citizens, we do not forget about you. As long as you have Medicare Parts A and B, Impact can be a fantastic secondary plan. And then small business owners of 49 employees or less, what we have found is small business owners are affected heavily with the high rising costs of healthcare. And again, these are groups of people that want to be able to afford healthcare for their staff. I mean, the longevity of their employee retention, so think about who do you know that owns a small business. And then last but not least, again, we have a Facebook group. This is just another resource. You are all welcome to join it. If you search Health Share Crusade Community or scan the QR code, you'll be able to join the Facebook group. You do not have to be an Impact member to join the Facebook group. And today's recording will be posted later on this evening in this Facebook group. So if you're asking for a playback, don't worry, we got you. And isn't it crazy? We're almost at the end of July. I mean, where did the first 7 months of the year go, right? It's about to be August. So if you are looking for your healthcare plan to start effective August 1st, if you're looking for your Impact membership to begin August 1st, make sure your application is submitted in by Thursday, July 31st by 5 p.m. Eastern time if you want it effective for August 1st. So plenty of time between now and then to get enrolled. The application process is super simple. Probably takes an average of 15 to 20 minutes, quick questionnaire, your details, and you can have your family enrolled. For an individual, it's as low as $73 a month. And for a family of 3 or more is about $378 a month. So extremely affordable healthcare. So you guys, with that, thank you for being here today. Thank you for being a part of this crusade with us. And we hope to see you on a future webinar. So have a great day, everybody. And I'm